Hey guys, I am Aravinda. Today we are going to discuss about the anesthesia team. Before everything, do you know what is anesthesia team means? The anesthesia team is a group of healthcare professionals responsible for administering anesthesia and ensuring the comfort and safety of patients during surgical procedures or medical interventions. The composition of an anesthesia team typically includes anesthesiologist. An anesthesiologist is a medical doctor who specializes in anesthesia and perioperative care. They are responsible for administering and managing anesthesia, monitoring the patient's vital signs during surgery, and ensuring the patient's safety and comfort throughout the procedure. Nurse anesthetist, certified registered nurse anesthetist, CRNA nurse anesthetists are advanced practice nurses with specialized training in anesthesia. They work in collaboration with anesthesiologists to administer anesthesia, monitor patients, and provide care before, during, and after surgery. An anesthesia technician is a healthcare professional who assists the anesthesia team by preparing and maintaining the anesthesia equipment and supplies. They ensure that all equipment is functioning properly and ready for use during surgery. Other supporting staff. The composition of the anesthesia team may also include other supporting staff members, depending on the specific healthcare facility and the complexity of the surgical procedures. These supporting staff members may include operating room nurses, nurses who assist with patient care in the operating room, including positioning the patient, preparing the surgical site, and assisting with various aspects of the surgery. Surgical technologists, technicians, who assist the surgical team by ensuring that the operating room is set up properly, sterilizing instruments, and handing instruments to the surgeon during the procedure. Anesthesia assistants. In some settings, anesthesia assistants may work alongside anesthesiologists to help with tasks related to anesthesia administration and patient monitoring. Respiratory therapists. These professionals may be involved in managing the patient's respiratory care during surgery, particularly in cases where anesthesia affects the patient's breathing. Pharmacist. Pharmacists may be consulted to provide expertise on medication management and drug interactions related to anesthesia. Support staff. This category can include administrative staff, transport personnel, and other individuals who help ensure the smooth functioning of the operating room and the safety of the patient. The specific composition of the anesthesia team can vary depending on the type of surgery, the complexity of the case, and the policies and practices of the healthcare institution. It's essential for all team members to work together cohesively to provide safe and effective anesthesia care to patients undergoing surgical procedures.